Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
When you're working at a critical access hospital such as Littleton Regional Healthcare, access to higher levels of care are sometimes hard to obtain. We do have board-certified emergency room physicians. We have physicians who take care of individuals in the ICU. All of that works well, but to be able to implement a tele-ED or a tele-ICU, for example, allows us instant access to a facility such as Dartmouth or a tertiary care center to have an intensivist who specializes in ICU level care. Tele-ICU is involved with every single patient that comes into our intensive care unit. They are notified of a new patient upon their arrival. They check in on that patient at least once or twice a day, and at any point when a nurse or a physician feels that they need a little more information about that or a little more guidance in their care, they're able to press a button, and within about 10 seconds normally, this individual will come onto a screen and be able to guide us in care decisions, even give us orders for our patients in order to get that care expedited as well as it can be. So here at Littleton Regional Healthcare, we're fortunate enough to have connected care in a number of different situations. I've touched on tele-emergency department, I've touched on tele-ICU, but we also have the facility to do tele-intensive care nursery, tele-neurology, as well as tele-psych. Mental health is underserved everywhere in this country. There is no question about that. The entire United States has a lot of room to grow with mental health. The facility of telehealth into the mental health population allows us to expedite that care for that individual. If that individual is safe to go home, they're not spending an entire day within the emergency department. But further, when hospitalization is the right course for this patient, most hospitals, such as Littleton Regional Healthcare, we are a conduit and a safe house for these individuals to then move to a psychiatric facility or a mental health facility, which we refer to as a designated receiving facility. So that institution of telehealth allows us to make that decision much faster than was previously available to us. Some individuals wait 2 days, some individuals will wait upwards of 20 days in order to get into one of those psychiatric facilities or designated receiving facilities. So any expedition that we can have via the telehealth conference that these individuals will have with mental health counselors is invaluable to all of us.